Hey everyone! So, if you're working in a place as busy as Hospital Sultan Idris Shah, you know the grind. You're constantly juggling resources, trying to figure out how well you're doing, and hoping the hospital gets paid fairly for all the complex work you put in. But how does that actually happen? How is it all measured? Well, today, we're going to pull back the curtain on the system that makes it all possible. Casemix and something called diagnosis-related groups, or DRGs for short.
I mean, really, have you ever been right in the middle of a crazy shift and just thought, how on earth do they put a number on all of this? How does the hospital prove that, say, the cases we're seeing at Serdang this year are way more complicated than last year's? Well, the answer to all of that lies in this framework called the Casemix system.
All right, so to really get our heads around this, let's zoom out and start with the big picture. First things first, what exactly is Casemix? At its core, Casemix is pretty much what it sounds like. It's a way to understand the mix of cases a hospital is dealing with. Think about Hospital Sultan Idris Shah, all the different patients coming through our doors every single day. Casemix gives us a snapshot of that entire population. It groups patients based on what's wrong with them, how sick they are, and, this is the really important part, how many resources they're likely going to need. Okay, now this is a really key point, and it's where people can get a little mixed up, but I promise the difference is pretty simple. Let's break down Casemix, the overall system, versus DRG, which is the tool it uses. So here's the best way to think about it. If Casemix is the entire library, the whole building and all its systems, then the DRG is how we organize the books on the shelves. It's the specific category, like cardiology or surgery or pediatrics, that groups similar patients together. It's the classification unit inside that bigger framework. And this slide just lays it out perfectly. Look at the scope. Casemix gives you that massive, high-level view, the whole hospital or even the whole country. It's like looking at the entire forest. But the DRG, that zooms right into the individual patient. It's the single tree, grouping each person's admission into one specific, neat category. So if you remember one thing, make it this. The DRG is the engine that makes the whole Casemix system run. It's the part that does all of the heavy lifting, taking all of that complex clinical information from our patients and sorting it into these standardized groups. Okay, so we've covered the what. Now let's get into the how. How does this DRG system actually work behind the scenes? What makes it a fair and reliable tool? You know, it all boils down to three really solid principles. First, clinical homogeneity. Basically, patients in the same DRG should have similar medical issues. Makes sense, right? Second, economic homogeneity. This is key. They should also use up a similar amount of resources, staff time, medicine, equipment. And third, statistical representativeness. You just need to have enough cases in any one group to get a stable, reliable average. Simple as that. So how do we figure out the cost for each group? Well, in Malaysia, the system uses something called top-down costing. Just imagine taking the entire budget for Hospital Sultan Idris Shah for the whole year, and then you just systematically divide it down. A piece goes to cardiology, a piece to surgery, and so on, all based on how busy they are and what they use. It's a really practical and fast way to do it, especially for a whole country. Now we get to the fun part, the numbers. This is the stuff that you, as a healthcare professional, might actually see on reports. Let's look at how all this data gets turned into real, powerful insights using a few key metrics. First up, we've got the case group weight, or CGW. Think of it like a difficulty score. The average hospital case in the whole country is set at a baseline of 1.0. So if a complex heart surgery has a CGW of, say, 4.5, it means that case is officially considered 4.5 times more resource-intensive than the national average. And that difficulty score leads us straight to the price per case, or how the hospital actually gets paid. The math is simple. You take a national standard base rate and you multiply it by the case group weight. So a more complex case with a higher weight, it naturally brings in a higher payment for the hospital. And finally, we have the big one, especially for hospital management. This is the Casemix Index, or CMI. All this is the average of all the case group weights for every single patient the hospital treated. It's the hospital's overall score for complexity. And this right here is a really important takeaway for all of us at Hospital Sultan Idris Shah. A high Casemix Index, that's not a bad thing at all. In fact, it's a good thing. It's the hard data, the proof, that we are handling more complex, more resource-hungry cases than the average hospital. This number is absolutely vital when we need to justify our budgets and plan for the future. So we've gone through all the theory, but let's get down to the most important question, right? Why does any of this matter for us on the ground doing the work every day? How does it actually help?
Well, the impact is huge. First off, it makes sure our hospitals get funded fairly for the real work we do. Second, it lets us compare ourselves to other hospitals in a meaningful way. It's not just about numbers of patients, but complexity. Third, it gives our bosses in the Ministry of Health the actual data they need to plan smarter. But maybe most importantly, it finally connects the dots between the amazing clinical care we provide and the financial side of things needed to keep it going.
So in the end, this whole Casemix DRG thing, it's not just some boring accounting tool. It's about creating this powerful, positive cycle. By properly measuring the care we give, we can better manage our costs. And when we manage our costs well, we can reinvest in what really matters, continuously improving the quality of care for every single person who walks through our doors.